Changemaker Award, from what I understand, is really being given for the advocacy work that I have done and the work within the community in the outreach generally that I have done whether it be in Ottawa or Vancouver, and just really trying to live with the diagnosis and communicate living with the diagnosis, that letting people know that there is a life after diagnosis, and that is huge, and from what I understand is a big deal, a big issue for a lot of people, and so the Neurological Health Charities of Canada this year are awarding the Changemaker Award to an individual for the first time. Well, I think for one, I have taken a positive outlook to my diagnosis, but also I've been able to use my experience in business to work with the society and both in BC and nationally to try to address the issues around stigma, to address the issue around stereotype. And I found early on, whether I was sitting next to someone on a bus or SkyTrain or whatever, that you know, I'd say that I have Alzheimer's, and you know, you'd almost pull out a checklist. Well, you can't have Alzheimer's, you know, we're even talking, and you can't have Alzheimer's because for this or that reason, and they were all so stereotypical, and I realized that the age issue, I was diagnosed at the age of 58, so between the age issue and just simply the understanding in the greater community of the journey of a person with Alzheimer's, that you don't, from the day you're diagnosed, go into, you know, end stage. You know, there is a journey, and so it was an opportunity to try to educate, and that's why I say I advocate to educate, and because really it is a matter of educating people, educating a lot of people. Being upfront with the diagnosis, so if in fact you are a caregiver or a person with dementia, to first of all just, you know, be upfront, tell people. I think that I shared a stage with a couple who said that they weren't telling friends and neighbors that he had Alzheimer's, that in fact they were saying that he had the small strokes, TIAs, and I always thought, wow, that was easier, or that's a better diagnosis than Alzheimer's, and so that's huge. But also just to volunteer and speak up or speak out on as you hear things in the community, or as you see things being written, that it's the little things that add up. It's not one big moment. That it's just the little things, and taking advantage of opportunities as they arise to say something. That often is the best and easiest way to change attitudes and help educate.